everyone, to the Buttercup podcast where we talk about early childhood topics. My name is Marisa Macy, and I'm the host of the Buttercup podcast. I'm super excited today because I have Dr. Serrano here, and we're going to be talking about early childhood practices in Portugal. And Dr. Ana Maria Serrano is an associate professor in the Institute of Education and researcher at the Center for Research in Child Studies at the University of Minho, Portugal. She has a degree in psychology from the University of Coimbra, and she holds a master's degree in early intervention from the University of Cincinnati in USA. She's also a Fulbright Scholar and a Ph.D. in child studies, a special education specialty from the Institute of Child Studies at the University of Minho. She is a professor in the field of special education and developed and coordinates one of the first master's program in early childhood intervention in Portugal. And she's been doing that since 1996. That's so cool. She is a member of the National Association for Early Intervention, and she's the president of the European Association for Early Intervention, also called EURLYAID, and a member of the board of directors of the International Society for Early Childhood Intervention. And she is part of the National System of Early Childhood Intervention. She coordinates the North Subcommittee's supervision nucleus. Dr. Serrano lives in a city in the north of Portugal called Braga.
Yes.
Yes, thank you so much for joining me today.
You're welcome. It's my pleasure to be also here sharing things about my country in early childhood.
Yes, thank you. So, how did you get started in the field of early childhood?
Yes, well, I finished my psychology course and I started working at that time. This was in the 80s, 82. I started working in a special ed school for that time was a special education school, and from the beginning I've been very, very much interested in working with children with disabilities, and so then we started. At that time, we started thinking about early childhood intervention, and I became very, very much interested in working with young children. And we created one of the first inclusive preschools in this school. This was a special school, but we created an inclusive preschool. And then from that point on, we started being very enthusiastic about early childhood intervention. I wanted to really learn more about it, and I came to study in the States at that time, and I was in Cincinnati. I had great teachers. The program was at that time was one of the first programs that put together early childhood special education and early childhood education. So I learned a lot. I had great teachers, Peggy Algas and David Kushner, and some of the names that I really appreciated during those times. And then I also had the opportunity to be visiting Frank Grant Child Development Center and knowing some of the work that has been doing in ECI. And so when I came back, of course, we had a team of people that were very interested in doing something similar to what was happening in the States at the same time, because the PL 994, the ECI legislation in the United States was just came out, and everybody was very exciting in the States too. So when I came back, we started developing a project. This was a local project in Coimbra, and we articulated the education, social services, and health. And we created local intervention teams organized that had people from these different ministries. And we started a program that was a lot based on some of the ideas of the legislation in the States. And of course, we had different resources, a different context, but we started, and Then this local project happened in 89. And then the first legislation, which was not yet a mandatory legislation on ECI, became available in 1999. And then finally, we had big debates here, and we were able to put a legislation that created what we call the National Early Intervention System, which has the same basis as the local project. It has local intervention teams all over the country. Now we support around right now about 27,000 children. And we have teams all over the country. So if a child is born in a very isolated area in the country, she still can be identified and referred, and that's very important for our country, which is a very small country, but still we were able to get to this point with the national system. So the law passed in 2009, and since then we have been working with these groups of teams and children and families.
Wow,
So that's how I started in this field, and of course I'm passionate about it.
Yeah. Yes. Well, I love that story. It's such a important story how countries establish the rights of children with and without disabilities. And to hear you tell the story of Portugal and how you established a countrywide system to protect rights of children. It's wonderful. Thank you so much for sharing that.
You're welcome. Yeah, and also in terms of education, let me tell you that because we just to give a little history, it's important to know that Portugal was we were in a dictatorship until 1974 when we had a revolution. And after the revolution, of course, we were a very poor, illiterate country because of the fascism and the dictatorship. But after the revolution, of course, we became a democratic country, and many people really fight for all kinds of rights for the population, but particularly children. We thought about children very strong. And I happened to have the fortune to work with some of the people who really put their effort in developing the early childhood education, universal, free access for all children in my country. And so I can tell you some numbers, like in 1987, only 30% of the children were attending preschool, 3 to 5. And right now in 2023, around 93% of children are in preschool from 3 to 5. And it's not mandatory. It's not mandatory, but still every child usually goes to preschool. And another thing that I'd like to say is also since the revolution, we tried to uh, integrate in the first phase, integrate children with disabilities. But then in 1994, after 1994, with the Declaration of Salamanca, we did a strong effort for inclusion. And right now, we don't have special schools for a long time, since maybe 1990, the legislation that closes the special ed schools was in 1992, I think. But they were now all children are in school. So our schools are from preschool, from childcare to universities. Now people with disabilities and children are in regular schools, and schools are the ones who have to answer their needs in these different contexts.
Yes, that's great. Thank you. Well, and you're a trailblazer, and the work you do creates pathways for children in Portugal, but you are also very active uh, throughout Europe with your role as president for EURLYAID, as well as international. Do you want to talk a little bit about EURLYAID and the work you do in your leadership role with EURLYAID?
Okay, yes, I am sure. I joined EURLYAID in 2000, around 2005, but EURLYAID exists since 1998. And EURLYAID was created because when the European community was formed, um, some countries were concerned if it was an open community and people could circulate to different countries. And some countries, of course, were concerned about services and support for children with special needs in the different other European countries. So they decided to create this group. And in first, it was just a group of parents, researchers, and practitioners that were very concerned about these issues. But slowly it started to grow, and in the beginning, when EURLYAID started, they even had some funding support from European community, but then that stopped. And now we are a NGO that really cares about disseminating good quality practices all over Europe on ECI, make sure that different countries are defending children's rights in this area and families' rights in this area. And basically, our work is to now support countries who are developing ECI systems also in Europe, because as you know, after the following of the wall in Berlin with the communist countries, most of these countries had very how should I say, very excluded policy in terms of taking care of children with disabilities. They lived in, most of them lived in orphanages, as you know. They were taken away from their families. And this, of course, this totally changed after the communism falling. And these countries are now, because they, as you know, also most of countries had signed and ratified the Convention of People with Disabilities. And so they have to, not only they sign, but they have to ensure that they do some work to make sure these rights are protected. So most of these countries are really now interested in developing inclusive practices, in considering the support to these children and these families. There are other organizations that have been key in terms of supporting this process in these countries, namely Open Society Foundation and UNICEF. And so EURLYAID has been also working a lot with UNICEF and Open Society in terms of training professionals. That's basically one of the things we also do. We support training of professionals that are starting to do inclusion, to provide supports for families in ECI. And so we started doing this in around 2012, and it has been increasing immensely, the work that we do in this area. And of course, I probably I will be retiring soon, but I will continue because there is a lot to still going on in EURLYAID after that.
Yes. Well, and your leadership role with EURLYAID is so exciting because this fall, in September, we're having the international conference in your country, in Lisbon, Portugal. There's going to be a joint conference with EURLYAID and the International Society for Early Intervention. And it's
Yes,
so exciting. It's going to be in the beautiful, beautiful country of Portugal. And I was in Portugal in 2019. And oh my
oh,
gosh, it's so beautiful there. And you have so many UNESCO heritage sites. And the pastel de nata is so delicious to eat. And fado, and so many great things. And I'm so excited to come to your keynote, Dr. Serrano, because you're going to be talking about the guidelines for evidence-based practices to
yes,
support
yes,
professional
true.
development. And
That's true.
Can you give us a little sneak peek or like a preview of what the SNIPI is all about?
Okay, the SC, we as I told you, we started this, the SNIPI, which is the National Early Intervention System in Portugal. We started in 2009. The legislation came out in 2009, and then we start developing in all regions of the country, the creating the teams, the local early intervention teams, working with the teams. And then, of course, we felt the need, and this was a group. We were like around 14 people. A lot of us were academics, were people teaching in the universities in this area of early childhood intervention or also early childhood education. And then we got together and we thought that we had to do something to support the development, professional development of the people who were working in the teams. And in these teams, what we call local early intervention teams, we have different professionals. We have a family doctor and nurses because they come from health, from the family health centers. Then we have early childhood special educators. We have also psychologists, social workers, and then therapists, physiotherapists, speech therapists, and occupational therapists. And they come from the different ministries, and the local teams are located in the family health centers, community family health centers. But they are just located there because they work in the schools. They support the children included in the preschools in the area. And then they also work with the families. So they go do home visits and go to preschools to support the team, the children that are included, children and families that are part of the system. So of course, as you know, the knowledge work, it's not just the knowledge base that you have as a speech therapist, or it's much more than that, because it's coaching, it's consulting, is supporting the community where the child lives, either at the preschool and in the family, so that they can, of course, impact the development of the children in these different contexts. And this is very key that, as you know, one of the bases of our work is to how we provide services can make a difference in terms of the principles and practices, which are family-centered practice. And family-centered practice is something that the more I mean this for many years, the more I believe that this is crucial. How you provide services to families, how you support learning and development also in the preschool, it's key. And so that made us really think carefully of building a guide that people could grab and understand what was this about being an early interventionist, and how much it is important to learn not only your own knowledge base, scientific base evidence of your own discipline, either you are a psychologist, a therapist, or a doctor, but also how you connect to families, how you create relationships with families and preschool teachers in order to develop and support their children too. So the guide was done in this spirit. We didn't have funds, and we applied at that time. There was a program from a foundation we have here in Portugal, which is Gulbenkian Foundation, is a rich foundation that supports some of these projects. And this was a project called Citizenship, and we applied for funds and we win this. But so we were together. It was the National Early, of course, the project was from the National Association of Early Childhood Intervention. At that time, I was also in part of this association. Then there was SNIPI, people from the coordination of the SNIPI that also were part of this project. And of course, we were 14 authors from the different universities and schools that train teachers, early childhood teachers and early childhood interventionists, and together with families, because we had already lots of families that had been part of the program of the SNP. So if you are interested and your students, they can read the book online in English because we translate it for many different languages. Now it's translated for almost 14 different languages, and English is one of them. And you can read what is the system, what would the importance of early years, a lot of more theoretical research-based information, but then also practical practical aspects of how we do our work, based, of course, in a lot of research, mostly done by the research in the United States, of course, because you have done a lot of the research we have in terms of early childhood intervention. And so I think that was a successful thing we uh, built, but it was a team, and it was a very strong team that we are still together, and we do a lot of things together in my country for early childhood intervention.
Yes, you do. And congratulations on winning the grant and being awarded the important funding that you needed to do that research. I think my students would really like to read the book you were talking about. And maybe Dr. Serrano, maybe you could send me the link. I could put it in the
I
show
do.
notes, or I can. Okay, awesome.
Yes, I'll do
And
it. I'll do it.
thank you for giving us a preview of your keynote, because I am going to be there in person and I cannot wait to see you share all of this wonderful information. And my students who watch this might not know this, but if you want to become a member of EURLYAID, and
Yeah.
EURLYAID stands for the European Association for Early Intervention.
Yes.
And we live in America, but you could still become a member and be learning and abreast of all the changes that are happening in Europe that
Yes, sure.
impact the whole world.
Yeah, exactly. They are welcome. Everybody's welcome. We have a lot of people already in our association, and we have people from all over the world. We have also from South America, from many different, from Africa. We have different people that you don't have to pay anything. It's free, the membership, and you will get our newsletters, which will the newsletters talk about the projects we do, the resources we have in our webpage, and also the conferences, because that's one thing we do. We tend to do every other year we do a conference in one of the countries in Europe. In 2023, our last conference was in Prague, in Czech Republic, and we had a huge conference there that was very, also brought people from all over the world. So I think that if they are interested, they can get access to this information. Also, the conference in Lisbon, I think that if they are interested, they should join. And the early bird is also not very expensive. We try to keep prices of the conference lower so that everybody can join.
Yes, that is so true. Thank you for doing that. I just got registered a couple of weeks ago, and it's very affordable, and having the free membership also is great. And you talked about early childhood intervention and ECI, and you're partnering this year at the Lisbon, Portugal conference with the International Society for Early Intervention, which is also free membership. So
Yeah.
you could, if you're interested in becoming more aware of what's happening on the world stage and international conversations, those both of those would be great to be uh, able to
But I mean,
continue to learn and grow. Well, you
yes,
talked
yes,
about family-centered practices, and oh my gosh, I love what you were saying. And that is so inspiring to hear about your work and the research you're doing with families. Uh, are there any other innovations or research that excite you today?
Well, I'm particularly now interested in a lot in professional development in this field because we've been training a lot of different people in the different countries, and it has been a very interesting experience also. That's an area that I'm particularly interested now. I'm reading a lot and I'm interested in supervision because supervision is also very important. It's like I think it is like a cascade of support for people that is working in this field is how you get this information and this support in your learning process as a professional too, and that can happen in many different ways, but also one of the ways, of course, training is very key, but then supervision, but supervision in the sense of reflecting your practice, a reflective practice together with the people you work with. It's crucial because of course, it's not easy sometimes to be in this profession, and we all need supporting each other in this process. So I used to say that it's like filling each other's bucket. It is the supervisor fills the bucket of the professionals, professionals fill the bucket of families, families fill the bucket of children. And I think that's an area that we really need to pay attention to because it makes a difference for quality practices. And that's a field that I'm now also very much interested.
Yes, and you do so much work with pre-service professionals and in service, and supervision is such a key tool in preventing burnout for not just administrators, but professionals and all of us that are part of the community, and also the reflective practices that you're talking about, and supporting people within our organization.
Yes, yes, I've learned that too. I've learned that through the years that really this is key when we do our work, and if we want to really provide quality support, we need to be also thinking about the work we do ourselves and how can we improve it in our in establishing relationships. Basically, it's also, I think that our work is key in this sense of um, empowering people in terms of the connections we have to do in our job daily, on a daily basis.
Yes, yes, thank you. Well, if you um, think back on your career, is there a highlight that you want to share with us? Something special, or something that uh, stands out as something that has been a highlight so far of your career?
Uh, uh, well, I I think I have a hard time, but I I think that when you do whatever you do, no matter what you do, and you feel that really you are being able to change something, that's what really I'm more concerned about and makes me happy in this process. So I think that being able to really change and building and a support system, particularly in my country, um, I, not only me, the team, because it was not just me, it was a team of people that I really care here in my country that have been doing this. And when we achieved what we achieved, now seeing that the system is is built, is strong, is continues to grow. Now is having problems, of course, because they need more resources, because more children are being identified and they need more resources. And then, of course, this is a process, needs a lot of continuing to think about. But seeing that was really one of the most important things I think that I've felt. And now that's why now I feel that with our experience and knowledge, we can also support others that are starting their journey in this area of early childhood intervention.
Yes, yes. Thank you. Well, how can listeners follow you and your work?
Um, they can follow me on these platforms like ResearchGate and LinkedIn, and also in my university webpage, the School of Education, Institute of Education. It's called my school. I'm also involved in, of course, training early childhood educators, but a lot in special ed, early childhood intervention specifically, and also in the EURLYAID webpage, because the EURLYAID webpage, they can also find a lot of different things we have been doing. We have a resource tool too that we call the Treasure Basket, based on the work of Emily Pickler. So it's a treasure basket for ECI, which is a resource web page that we usually put things there for people interested. And so I think they can follow us there in the EURLYAID web page too.
Yes, thank you. And the treasure basket. I think that is so cool.
I love it too. I just to let you know that my child now is an early childhood educator too. So I learn a lot about
Oh, yes.
yeah, she became an early childhood educator.
Is she also in Braga?
Now, because here early childhood educators in the public system, when they start, they have to do like almost 3 years in different parts of the country. So right now she's in the south, in Grândola, in the south.
Nice. Well, what a great role model she had growing up with you and getting to see the important, meaningful work that you do. And uh, what an exciting thing when your child uh, follows you in your footsteps.
Follows our steps. Yes, I'm happy about that. But I didn't, of course, I didn't say force or anything.
Oh, that is great. Well, thank you so much, Dr. Ana Maria
You're
Serrano.
welcome.
Thank you for all your work. Thank you for being on this podcast. And it's so exciting to hear about Portugal and all of the neat early childhood practices that are happening in your country. Thank you.
Thank you too. It was a pleasure being with you, Marisa Macy. I've heard about you, and I hope to see you and meet you personally in Lisbon in September.
I know, I can't wait. I can't wait. And also thank you to our mutual friend who put us together. Because
Ah,
I
yes,
think,
Paula.
yes,
She's my
I
colleague. She's my colleague for many years. Yeah.
so I think that's one of the things that I didn't know before I became a professional in this field, how important relationships are. Not just where you are, but afar also, because you never know where it stops. Um, and
Yeah.
uh, and we got to meet each other through our mutual friend, Dr. Pereira, and so that's one of the things I try to stress with my students, how important becoming part of a professional membership is, going to conferences and networking with people and supporting each other and creating a community of practice. And anyway, you inspired me
Yeah.
today. Thank you, Dr. Serrano.
Well, thank you to you to give the opportunity to share our experiences here in Portugal with your students. It was a pleasure.
Thank you. And in Portuguese, is it obrigado? Obrigado.
Yes,
Obrigada.
obrigada. Because it's feminine is obrigada, and if it's masculine is obrigado.
So if I'm saying thank you to you, I would end with the A.
With
Obrigada.
an I. Obrigada. Yeah, exactly, exactly.
Obrigada. Obrigada. Uh,
De, de
I have to
nada.
get my dictionary out again because when I went in 2019, I learned a whole bunch of words before my
Oh,
trip,
great.
but now I forgot them all. So I have to practice my Portuguese.
Yes, true. But we until then you will be fine. We will practice. Okay.
Obrigada, Dr. Serrano.
Nada, de nada.